Okay. Okay. Testing. Ooh. We did crank it up, didn't we? Hi, everybody. Okay, I see some friendly, familiar faces. See some friendly new faces, and the mean ones are sitting in the back. I see you. All the misbehaviors are in the back, so I can come right back and get you. My name is Dr. Devin Luzod. My goodness, it has been a while since I've been able to come back here and speak. Been coming here for almost 10 years, so thanks for having me again. I mean, actually probably longer than that. I feel like a resident now. My in-laws have just moved in. So, you know, now I really got to be on my best behavior. Okay, can you hear me? Did it turn on? Okay. So today's class is going to be all about balance and the inner ear. So how do we get better balance? Tinnitus, things called many ears disease, just ringing in the ear. And I'll go through some what we would call medical ways to get better balance, but I'm more of a natural doctor. I don't prescribe drugs, I don't do shots, and I don't do surgery. So what we'll also be doing is talking about things from a natural perspective, okay? Because I'm not against drugs and surgery, but what all
You turn that off so we could listen to you.
this is distracting you, isn't it? Well, Jesse and I were going to do that act here in a minute. So, yes. And we're taking volunteers. So look, I'm not against drugs and surgery, but would you all agree that, you know, because of the side effects to drugs and the complication of the surgery, would you all agree that it's better to try to solve things naturally when you can? Yes? Okay? You know it's okay. The interesting thing is that we as a country spend far more money than any other country on drugs and surgery, on medicine. Like in the trillions. We're number one. We spend the most. We're number one. But where are we ranked for our health worldwide? We're like the 30s or 40s. So we spend the most, and we're ranked one of the worst. We spend the most on health work. So what does that tell you? It tells us that there's got to be a better way than throwing all of our money and time into medicine and drugs and surgery. And look, a lot of you have prescriptions. I've had to take them. I've had to have surgery. So we're not against those things. But again, when we can solve things naturally, we do it. The other big factor in all of healthcare and wellness is being proactive, being preventative. Okay? By show of hands, how many of you agree it's better to be proactive than wait till you land in the emergency room? Okay? Now, how do you know that you're being proactive? Okay, what is prevention? Is prevention, well, I hope it'll go away on its own. Okay? Do health problems tend to go away if we just ignore them? Okay? Yes, unlike some people, if we just ignore them, they do not go away. In fact, they get worse. Cost more money. Do you know the number one cause of personal bankruptcy in our country? It's from health problems. Now, yes, there's unforeseen things, but a lot of those health problems are avoidable through lifestyle choices. Which brings me to my next topic, which is, does anybody know the number one top cause of health problems in our country? Number one. You can guess, it's okay. Interactive. Diet, obesity, diabetes, heart attack, okay, falls. The number one cause of health problems in our country is procrastination. According to the World Health Organization and the CDC, and a number of other health sources, most of the things that get us, not so much the cancer, we obviously don't have that one figured out yet, but the diabetes, the Alzheimer's, the obesity, the heart problems, Most of what gets us, even things like chronic pain and arthritis, a lot of it is from lifestyle choices. Okay, so oh, I'll get to the doctor later, I'll take care of it later. Right? Oh, I'm on a limited income, I don't want to spend the money. What's more important than your health? I mean, faith and family. But outside of that, what's more important? All right, I don't know many millionaires, but I know a few, and they would give all their money to have their health back. So the takeaway from that is procrastination is the thief of health. If you get nothing else out of today, and we're going to give you a lot of information, and then we'll take some Q&A at the end. If you get nothing else out of today, get that we want to take action earlier. We want to be more proactive and less reactive. Because the more reactive you are, costs more, problem gets worse, maybe it's not even solvable. Would you agree with that? Okay. I think we're all on the same page. So let's get rock and rolling with some material here. How do we lose our balance? A loss of balance, it often occurs due to a problem with the signals the ear sends to the brain. Now, what happens is your brainstem, which sits here at the top of your neck, controls everything. Okay, controls thought, controls nerves. Your brainstem is surrounded and protected. Does anybody know what the bone is called? It's the top vertebrae in your neck, called the atlas bone. It's nicknamed the atlas because it holds your head, holds your world up. So that top bone surrounds and protects what's called your brainstem. Off of the brainstem come what are called cranial nerves. One of those is the vestibulocochlear. That vestibulocochlear, if it gets pressure on it from a number of things, it can cause balance disorder. So these signals, which travel along nerves, usually control our sense of balance and spatial awareness. Okay, spatial awareness is obviously, when you have pressure on your brainstem, you wouldn't know that the table is there. You think it's another foot away or even a foot closer, or you think a step is there, and it's much further away. So, this pinching of the nerve is very common with structural misalignment with the top cervical neck vertebrae. So when someone is in a fall, accident, bad posture over time, that's how this top bone can move out of place and can pinch the brainstem. That is a major, probably one of the number one causes of balance problems. So it's like pinching a water hose. An upper neck misalignment pinches the brainstem, equilibrium, and other nerves. So you could experience a loss of balance, spinning sensations, unsteadiness, lightheadedness, dizziness. Thanks. A structural misalignment of the upper neck can occur from everything we talked about. Do you know what the dowager? Anybody know what the dowager's hump is? What is it? It's like this, right? Yes, this thing. Yeah. It's also called the kyphosis. A lot of you are starting to form it. Some of you your heredity isn't causing it, but you're set up for it more because mom had it, grandma had it, and it's this big thing that grows back here. That is a huge cause of balance problems. It's one of the things I treat in the office. It's called the dowager's hump, or kyphosis, improper reading position, looking down at phones. I mean, 20 years ago, there was no texting. Now, a lot of you are texting. I don't even know what young people's faces look like. All I see is the top of their head. Balance issues can arise from disease and health conditions which affect the brain or inner ear. So there's other health conditions that can cause it. Ear infections, even from medication, which we'll go over that a little bit, and neurological disorders. Okay, let's kind of go over some of the diseases with loss of balance. Labyrinthitis, it can cause dizziness, nausea, loss of balance. It's basically an infection of the inner ear or the vestibular system. So the structure of the inner ear gets infected or inflamed and can cause loss of balance. It can also affect hearing. People may develop labyrinthitis after upper respiratory infection, things like the flu. Okay, many years disease. Anybody familiar with that one, know that one? Just one? Okay. It's another condition that we see in the office. It affects the inner ear. Basically, fluids build up in the inner ear, making it difficult for signals to reach the brain. That's a repeated theme. The ear nerves have to get to the brain. When that's blocked, that's where a lot of dizziness, ringing in the ears, tinnitus comes from. Vertigo, that's a big one. You guys know that one, yeah? Okay. So it's a symptom of various conditions, but it accompanies a loss of balance. There's two main types. One is called peripheral vertigo, which results from a condition affecting the inner ear, such as infection, or an impingement, again, of the nerves, because of a misalignment of the upper neck. And then central vertigo. Central it's not that common, can be a result of a neurological disorder such as stroke or multiple sclerosis. So the patients I see with vertigo usually don't have this more rare common. Most of them have the peripheral, which is an impingement on that nerve in their neck. Okay, benign, we won't go too much into this one. It's benign paroxysmal positional vertigo. Basically what happens is you move crystals, get in the way of the fluid, and that affects balance and dizziness. Okay, lightheadedness is associated with a lot of things. The feeling of lightheadedness is also called presyncope. Can also be due to something like blood pressure. Okay, medication, this is an important one. Some drugs may cause loss of balance as a side effect of affecting the inner ear. People can feel lightheaded, creates drowsiness. So certain drugs that can cause balance are antidepressants, anti-anxiety, those for blood pressure and heart disease, those for diabetes and sedatives. Obviously, I'm not telling you to get off the medication, I'm just telling you to be aware. Okay, vestibular neurontis. It's an infection of the inner ear that causes dizziness, and we don't need to go to this last one. Okay, this is an important one here. It's called acoustic neuroma. It's not cancerous, but it's a tumor that affects the inner ear nerve. So when people have this, I don't treat that one. We do send that initially to get checked out to make sure that it's benign, but it usually is benign. But it's again, it's a growth. It's a benign tumor that causes balance. Okay, and then obviously stroke. If a person experiences a loss of balance and coordination, along with the following symptoms, it could be a sign of stroke. So anybody that thinks that they or someone near them is having a stroke, obviously call 911. Here's the symptoms to look out for. Numbness on one side of the body now. That's not ongoing numbness. I see patients in my office with pinched nerves down the arms. It's ongoing, maybe like they're reading or they wake up that way. Numbness, tingling in the hand. That's not it. It's more of a sudden onset of it. It's usually on the left side, but not always. Okay, sudden onset of vision problems, severe headache suddenly. Again, I treat headaches in the office. This isn't an ongoing headache. That's not a sign of stroke. But severe, sharp headache that's new. Sudden weakness, nausea, vomiting, confusion, trouble speaking, understanding. All right, let's talk about some of the symptoms associated with loss of balance. Some you know, some you don't. Believe it or not, anxiety or sudden anxiety or panic can be associated with loss of balance. A sudden change in blood pressure. A lot of you are checking your blood pressures regularly, so you want to keep an eye on that. Okay, sudden blurred vision, nausea, vomiting, diarrhea. All of that is associated with the loss of balance. Okay, how does medicine, so again, we'll talk about kind of the medical side of it, we'll talk about the natural side of it. How does medicine, like in a hospital or quick care, diagnose loss of balance? A lot of times they'll refer to what's called an audiologist, okay, or an otolaryngologist, that's a tough one, who specialize in hearing conditions affecting the ears, nose, and throat. You may also go to an EENT. People may need to undergo different types of tests during the diagnosis. So medically, they would look at blood, they would do hearing tests, tests that measure eye muscle movement, brain activity, things like sitting in the chair and checking your eye movements. You'll love this one. Attaching electrodes to the neck. Sound fun? Okay. So what are the medical and drug and surgical treatments for loss of balance? Okay, so if a certain type of medication causes a loss of balance, a doctor is going to work with you to look at options. People can use the Epley maneuver. Anybody know the Epley maneuver? Okay, I'm going to show it to you. as well, because the Epley maneuver is something that many people will do at home. Doctors allow them to do it at home, so I'm gonna kind of teach you it and give you some resources for that as well. Set of movements, basically what it does is it dislodges the crystals in the semicircular canal and returns them to their correct position. The doctor will teach you how to do this, okay? So I'll teach you that. If a person has an ear infection that causes a loss of balance, you may get antibiotics or antiviral medications. So in our office, I also see children. I see very young children all the way up to, I have a 94-year-old in the office right now. I keep saying I'm so proud of her because she's 95, and she keeps reminding me, don't add a year. But when kids have ear infections, and adults can have these, which affects balance, what happens is the neck gets so tight that the fluid can't drain. Fluid moves up and down your body all the time. If anybody has a swollen knee, same conversation, fluid has nowhere to go, so it accumulates. So when you have an ear infection, fluid accumulates, makes a nice little pool or bath for bacteria, so bacteria grows. So when I treat someone, what it allows the neck to do is feel better, but also let the fluid or swelling drain out, which helps the infection, helps the inner ear problem. If a person has many ears disease, a doctor will also give medication to treat the nausea and dizziness. They do injections, okay, or apply what are called ear pressure pulses. People with many ears disease can also make lifestyle changes, such as stopping smoking, which shouldn't we do that anyhow, limiting salt, alcohol, and caffeine intake, but unfortunately there is surgery that they may need for that. Okay, according to the National Institute of Neurological Disorders, if people feel lightheaded due to a triggering effect, such as the sight of blood, they may be able to avoid fainting by, listen to this, these are ways to avoid fainting if you're losing your balance and you go lightheaded. Clench their fingers into their fists, tense their arms, cross their legs, clench their thighs, sitting together tightly, sitting with their head lower than their heart, or lying down to prevent falling. Okay, now let's get into improving dizziness, balance, vertigo, ring in the ears from a natural perspective. Okay, so I do a very gentle procedure in the office. It's called NUCA. It's an alternative to standard chiropractic. Standard chiropractic, I'm not against any type, but standard chiropractic involves manipulations or using a higher amount of force. We use an alternative to that. It's called NUCA. It's very, very gentle. It's a very light pressure to the top of the neck, which affects the top bone, which is the brainstem area. So when I treat people with tinnitus, vertigo, balance problems, we align this area, which helps get the head on straight, pressure off the brainstem, and improves everything down underneath. So let me actually show you. Now, we're going to try the volume on this. You don't need volume, but we'll see if we can get some volume on this. And this is the Epley's maneuver. I'll walk you through it, and it's got closed caption. Forget the volume, we'll just do it this way. Okay, there's our friend the crystal. And so what you're going to see in a minute is how to have the patient, or you're able to lay on your side, and this crystal from your inner ear goes back and forth in the canal. Turn your head to the side, lay back, and the head is at 45 degrees. So then after that, you turn the head to the other side, which you rotate at 90 degrees, which ends up being 45 degrees. Turn to one side. Natural remedies for dizziness and balance. There's several natural remedies for balance problems. There are even some foods and supplements that can help you with the symptoms. So first, you always need to think about hydration. It's a big thing, especially where we live. Dehydration can cause dizziness. If you're feeling tired and thirsty, along with that dizzy feeling, obviously drink more water, electrolytes. I drink more electrolytes now. You can get them from all types of sources. That's what keeps the water in the cells, keeps you hydrated. Okay, here's some other natural remedies for dizziness and balance. Ginger, or drinking ginger tea, may relieve symptoms of nausea or motion sickness associated with balance. Vitamin C has been proven to help reduce vertigo symptoms for those with many years, but you don't even have to have many years. We found that regular doses of vitamin C, not mega dosing, just regular doses as prescribed on the bottle. Vitamin E, which can help circulation problems. And D may help after a benign positional vertigo attack. By the way, where else can you get vitamin D other than supplemental? Okay, apple cider vinegar and honey are believed to have curative properties to relieve blood flow to the brain. 2 parts honey, 1 part apple cider vinegar can prevent and treat vertigo symptoms. Almonds, rich source of vitamins A, B, and E. Eating a handful of almonds can help with vertigo symptoms. The truth is, science doesn't even know how that helps yet, but we know that almonds have a big effect for that. Almonds, interestingly enough, can have a good effect for people with migraines. I treat migraine patients, and we have them eat more almonds, and for some reason, there's theories, but for some reason, the vitamin content in that can help. Just as a disclaimer, I have to say this, check with your doctor before taking any of these, just because it could interfere with your medications. Okay, I want to show you, I've done this interactive before, it works better if we just show a video. I'm going to show you 4 at-home exercises that you can do to help improve your balance.
I think the volume will work on this.
First is the sit to stand exercise. Start by sitting on a solid chair. Make sure it won't roll or slide away from you. You may want a table or something sturdy in front of you in case you need to brace yourself. Sit so you are positioned at the front edge of the chair. With your chest forward, stand up while squeezing your glutes until you're fully upright. Don't rush. Then slowly return to a seated position on the chair and repeat 10 times. If you need to, use your hands to push off of the chair onto a standing position. The goal is not to use your hands at all. The second exercise is a good one if you tend to get dizzy easily, called ankle pumping. Whether you're getting out of bed or leaving the dinner table, before you rise, take a moment to pump your ankles. Point your toes up to the ceiling and then down to the floor several times. This will help get the blood flowing through your body. And don't forget to take a few deep breaths. Number 3 is the single leg stance. Simply stand on one leg, which should be slightly bent. If you need to, hang onto a chair or table for stability and work your way to no hands at all. After 30 seconds, return that foot to the ground and raise your other foot up and hold. Repeat this exercise on each leg 5 times. To add a little challenge, hold each foot out in front of you rather than straight up from the ground. Be sure to keep that core tight. The last one is the heel-to-toe walking. Hold yourself erect, place the heel of one foot directly in front of the toe on your other foot, and alternate feet until you take 10 steps. Try to keep your chin up. And that's it. If your balance is unsteady, I encourage you to make sure you have someone around in case you do lose your balance.
Say that again? You're good? Okay. The progression.
So the progression on that is you always want to do it eyes open with something stable around you. Okay, so even if you're going heel to toe, heel to toe, heel to toe, you want a bar, a wall, something around you. Once you can do these activities stabilized, then you do it without stability around you. Okay, such as standing on one leg, okay. And then what's the final progression? Eyes closed. Okay, so it would be, so we do a test in the office. So when I see patients who have just had an auto accident, Whiplash is a big cause of balance problems. So when I sit down with a patient who has vertigo, balance issues, we always look at their history. Not always, but sometimes, usually actually, there's some kind of trauma. Auto accident, fall, something like that, causes a whiplash to the head. Okay, so that will affect the brainstem and balance and equilibrium. So the test that we do is stand on one leg, and if you wobble, that's a fail. Now you're supposed to be able to get to 25 seconds. So when you're working at home, 25 seconds like that. Okay, and then we close the eyes. Oh, there I go. Okay, so that's the progression. All right, so let's get into the other big causes. So this here is what your atlas bone looks like. It's a big long bar that sits at the top of your neck. And this structure here, that's your brainstem. So that's what we were referring to earlier. Out of this guy come a bunch of little nerves that run up into the ear, vestibulocochlear nerves. So try to think of the atlas like a big ring that surrounds the brainstem. If you have any type of misalignment there, what you'll be able to do is you could actually go home, look in a mirror, and you'll see that one eyebrow is higher or lower than the other, or one ear is higher or lower. You have head tilt. Okay? Or even though you're straight ahead, you have slightly rotated neck like that one way or the other. Those are all symptoms of a misaligned atlas. One of the other symptoms is one leg being shorter than the other. So if you have a partner, you would lay on your back and they would check your leg length discrepancy to see if one leg is shorter. Because when your head is tilted, your head's about the same weight as a bowling ball. Okay? Men's heads tend to be a little thicker than women's. Wait, did I say thicker or heavier? Ask my wife. So when your head is tilted this way or that way, what do your shoulders do? What do your hips do? Okay? That's why you'd end up with one leg shorter. Wherever your head goes, your body goes along with it. We talked about the dowager some. What happens is over time, our heads start to go more and more and more forward. I know you see one or two people every now and then that are way out here like this on a walker. We got to avoid them. Okay, but what happens is these bowling balls start to go more and more and more forward. This hump gets bigger, 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 and then we just kind of fall right along with it. So when I evaluate people for atlas misalignment, we're looking at this area. Presents as head tilt, head turning. I take what are called digital opposing view x-ray studies. Best type of films in the field. I wish more docs would take them, but we examine this area and evaluate it to see if it's misaligned. As much as 1 to 2 millimeters of misalignment can put pressure on the brainstem. That's the weight of a dime, so it takes very, very little to impinge the brainstem. MRIs don't pick this up, hospital x-rays will not pick that up. The reason is when you take a regular hospital x-ray or an x-ray in your medical doctor's office, your mouth is closed, and so your teeth actually block the atlas. They would never see it on an x-ray. So we take specialized films at certain angles to be able to see that, or these guys do. Okay, this is important. So cervical vertigo, big cause of vertigo and imbalance, also called cervicogenic dizziness. It's a feeling of disorientation, unsteadiness caused by a neck injury. So that's what I talked about earlier, old neck injuries. It's almost always accompanied by neck pain. Now, it doesn't have to be sharp pain, but we'll look at a patient history who has vertigo and dizziness, just, my balance isn't great. How's your neck? Well, it gets tight, but I'm used to that. Right, but that's part of it. Tight neck, tight shoulders. Your range of motion can be affected. Range of motion is so important. Okay, so one of the tests I do with a new patient is we'll check range of motion of the cervical spine. Do you have 80 degrees? 80 degrees. And forward, back, side to side. And if you don't, one of the concerns with that, oddly enough, is just checking your blind spot for those of you that are still driving. You know that the DMV can take a patient's license if they have reduced range of motion? It's on their website. They're allowed to do it. So keeping your range of motion is one of the most important things I do with patients, is reestablishing them from this to being able to turn their head. And more importantly, getting there in time where the bones themselves don't fuse together, because then you see the people that they kind of turn and they do that with their whole bodies. That's what we need to avoid. Okay, so range of motion can be affected. Sometimes It'll even accompany a headache. Episodes of cervical vertigo can go on for hours, and then obviously years and years. Okay. So, your brain and the brainstem here, it sends the nerves all the way down the spine, and the nerves come out the side that control every muscle, cell, organ in your body. So when you have a bone out of place at the top of the neck, that's what will, for example, impinge the brainstem, but it'll also cause a number of things, cause headaches. So this is the bone here, C1 and C2, that protect the brainstem. It'll run up into the head, cause headaches, cause vision trouble, cause inner ear trouble, so balance, dizziness, migraines. Now the middle of the neck here, this bone protects the nerves to what's called the thyroid metabolism. It'll also control these nerves going out and down the arms. So when someone has numbness and tingling down the arms, that's why it can be associated with balance problems, not because the arms affect balance, but because there's pressure here on the neck. And in this dowager's hump that we talked about here, those are the nerves that run to the heart and lungs. So the research out of the Journal of the American Geriatric Society, which is the #1 journal on aging, now says that if you are growing or developing this dowager's hump or thoracic kyphosis is what it's called, your mortality rate increases. You're more likely to die earlier. Why? Because what happens is as this grows, I mean, yes, it doesn't look very good, but it compresses your lung function, which compresses your heart. You can lose as much as 30% lung capacity when you're developing this. That's why I work on that in the office so much. Okay, out of Harvard Medical School, why good posture matters. So Harvard is now doing studies on how your posture is affecting balance. We just talked about one big reason growing this hump, also having your head tilted one side or the other, kind of locked that way, misaligned. That will affect your posture and your balance. Okay, this is what a thoracic kyphosis will look like. This is actually not even perfect, but this is okay. And then this is what happens. That head goes forward, and you can see it stretches the cervical spine, which causes a significant amount of pressure here. So I'm going to actually show you a short video here of just how I treat that in the office, so you have an idea of how we do that.
I've been practicing about 20 years. We do a very gentle style of chiropractic. Come with me, we're going to meet a few of our patients. Hi, Garrett. Good to see you. Okay, step into my office. Garrett, come on the scales. Okay. All right, so on day one in our office, we do a thorough history and digital x-rays.
So that's a gentle adjustment to the neck, and then we use that little tapping thing, it's called the woodpecker, to not only open up the bones to get pressure off bad discs or like arthritis, pinched nerves, pain, but to help the rotation of the vertebra to increase range of motion. Okay, so I'd like to teach you a couple more things about good posture, because as we talked about, Harvard talked about, can I borrow this chair? Thank you so much. All right. I know, so let's see what's inside of that. Okay, so let's talk about good posture, which will help your balance. All right, so everybody lean forward in your chair a little bit. Good. Now scoot your rear end all the way back till you hit the back of that chair. Now sit up. Oh, everybody just got about 10 years younger. Here's what happens, guys, is when we're in a chair and our butt is not all the way back, our back will slouch and bend until we find the back of that chair. See that? And you have this big gap underneath. Now, your lumbar spine is meant to curve forward, just like your neck is meant to curve forward. What happens is, if we are slouching, we lose that curve and the discs become more vulnerable. Okay, so we scooted back in a chair, we sat up. I want you to do the same thing when you get in your cars next time. And then adjust your rear view mirror. Because then the next time you get in your car, if you can't quite see out of your rear view mirror, guess what you need to do? No, don't adjust the mirror, you sit up. That was cute. But I guess that is a solution. Okay, so now what you can also do at this point is you stick a little pillow back behind you, because that supports that lumbar curve. Okay, so do this in your car, do this at home. Some couches are so deep, you need to have that pillow behind you. Now, I don't think we have it. Sometimes people's feet won't hit the floor when they do that in certain chairs, so then you need that pillow behind you. It'll help your feet get closer to the floor, or you put a pillow underneath you. Okay, but that's good posture. Now what I want you to do is everybody just bring your shoulders back a little bit. Squeeze those shoulder blades together. Oh, the whole room just got about another 10 years younger. See that? That's good posture now. We teach our patients this, we teach our patients a lot of posture, stretcher exercises. What I found is just by adjusting people and treating them, the posture improves, but if you're not doing this work on your own, it is very easy to get back into this, okay? But just improving this posture, reducing this hump, working to get your head on straight will have a tremendous effect on balance, the inner ear, and pressure on your nerves. Okay, guys? One of my mentors once told me, don't talk for longer than an hour, because if you're not that interesting, people will be bored. So I try to keep my lectures around 35, 40 minutes, but we always save time for Q&A. So that's where we're at now. And by the way, in our office, what we do, if you've never been a patient at our office, is on day one, we do just a very thorough workup. We take health history, we take an exam, we're going to do some of the tests we talked about. We're going to measure your balance. I have 2 digital scales where you put 1 foot on each scale. And if you were perfectly balanced, you'd have equal weight on each side. But we see how someone's leaning off one way or the other. Okay, so we check range. So we do a number of tests, not just on balance, but on the entire spine. We usually take what are called digital opposing view x-rays. Again, best type of film in the field. And then that's our day 1. Our day 2, I need time to study the film, so I take an hour or 2 and study them. On the second day, when the patient comes back, we review everything. I'm going to go over, first off, if I can even help. I'm really straightforward. If I don't think I can help someone, I'm going to tell you, and I'm going to get you to the right doctor. If I think I can help, again, we're really transparent. We tell you how long it'll take, like when could my pain go away, or when could I get better balance, when could I get back out in the yard, tennis court, travel, drive, when can I hold my grandkids again, when do I get to a point where I'm doing so well that from there, we'll just maintain every now and then so it doesn't come back around and get you. Okay, so I go over time, I go over cost, I go over coverage, everything, because if you're anything like me, you don't want financial surprises, when you go to a doctor, okay? I don't charge just to sit down and talk with people. I will tell you up front, x-rays are never covered by Medicare or replacement policies. They just don't do chiropractic x-rays. So out of pocket, those are $90 per area of the spine, $90 for a set of films, and we'll go from there. Okay, guys, so we'll take questions. The gals have my information at the table. Go for it. Any questions?
Anything to do with sciatic nerve?
Yeah, I see quite a bit of sciatic nerve. Okay, so she asked about sciatica. So sciatica is when you have the lowest bone out of place, which is called L5, and what's called your sacrum. You have a bundle of nerves that come out of there and they run right through your rear end. There's a little muscle back there called the piriformis muscle. Okay, so when these bones are out of place, it pinches that sciatic nerve, and boy, it'll cause raging pain down the leg. Variations of that will actually go in the front or around to the groin, so we see all of those. And the x-rays will show me how much that bone is misaligned and what direction to treat it. So we take the little tapping instrument and just tap that bone back into place and get it off the nerve, and then the sciatic nerve. It takes time, but it can heal. Same with neuropathy.
Is it tapping periodically, regularly? You have to come back for the tapping?
Oh, the adjustments. Initially, we spend a little more time. I mean, it's the downside of what I do, even though it's natural and nobody's cutting on you. It takes some time initially. But yeah, down the road, one of the great things about our office is I am then going to teach a patient specific stretches, exercises, posture, and it won't be like a handout that I pull out of my desk and give to everybody. I put together a customized video detailed description based on, for example, your x-ray, your posture, and if you're doing that down the road, you don't have to see my funny face all the time.
And what do you, can you help scoliosis?
Yes, scoliosis is a big deal. Okay, we see quite a bit of that. And I'll tell you there's two types. One is obviously, we see a lot of children with it. When we get to about, and again, scoliosis are these big twists and curves in the spine. They happen at or with childbirth or in early development, and they worsen. So you get to about 18 because the bone's hard. Now from about 18 to 50, scoliosis doesn't actually change much, right? Because the bones are hard. But you get into your later 40s, the bones start softening, so scoliosis picks up where it left off. And that's where we have to jump in and start working on it, because otherwise it will keep bending more, and what do? That's why one of the reasons we shrink as we get older is because the bends you had as a kid are now getting worse. So we use the tapper, which is called the arthrostim, and we adjust into those curves, which can start to straighten it out. Make sense?
Okay, and you said that...
One question per person. I'm just kidding. Keep going. No, I'm just kidding.
you mentioned that the x-rays are not covered by Medicare. Are any of your...
Yeah, some of the treatments, they do help out with, look, I'll be straightforward with you. Medicare and replacement policies, they tend to cover the things that cut you open, not so much the natural stuff. You with me? The natural things is always more out of pocket, but they do help out a little bit. So to answer your question, once we get the films and once we sit down, I'll go over with people what they will and won't do, and that way you have an idea. Okay?
When you were doing the video, why was that gal...
Nystagmus. The eyes.
Yeah, I was wondering...
Yeah, sometimes the eyes do like that. It's called nystagmus, which is also a pressure on the nerve.
Oh, okay. And you said that the infections sometimes cause the vertigo.
Yes.
Do the infections always hurt? I mean, are you always aware that you have an infection?
You're not always aware that you have an infection, but sometimes swelling and pain does accompany your infection. And sometimes, and obviously if it's viral, antibiotics don't help it.
How about loss of hearing? Does that affect balance?
Loss of hearing can affect balance, but again, there's so many causes of loss of hearing, it may not even just be the loss of hearing. Crazy enough, 120 years ago, the very first chiropractic adjustment in the 1800s was reported to have returned somebody's hearing. I don't claim that, don't get me wrong, but that's how chiropractic started.
Okay. And just one more.
Okay, one more.
Just one more. I've heard people have experienced fainting when they're standing up and they lock their knees. Like people in choruses or...
That's true. What you always want to do if you're standing for longer than 10-15 minutes is just put a little bend in your knees.
And why does the...
Blood flow circulation. Your legs represent one of the biggest set of muscles in your body. You just got to get the circulation flowing.
All right, that's it.
Well,
Thank you.
I want to tell you, those are good questions. And even in my office, I'm the type of doc that will always take the time with questions, so I don't mind at all. Yep.
Thank you.
Okay. Well, I'll just go around, so I'll get everybody, don't worry. Yep, we'll start here.
On your first video, you showed the exercise for the inner canal, and I see that dummy model, the eyes moving back and forth. Are there anything associated with it?
Yeah, she just asked that. It's nystagmus. Sometimes the eyes will go back and forth in that process. Pinching of the nerve up to the optic nerve.
So that is because of that your position?
Yes,
or-
and the crystal is moving through the ear canal.
Can anything be done for back fractures caused by osteoporosis?
Yes, she asked about, can anything be done for back fractures caused by osteoporosis? So two types. One is a little bit of an older one that is now healed. Anytime you have an old fracture, it actually heals stronger than the new bone. Because the calcium that's put there, that the body puts down to heal it, is actually stronger than your bone. So those we work with just fine. If someone has a fresh fracture from osteoporosis, we just work around the other areas. So for example, when I have a patient who's been diagnosed with a lumbar fracture, we work actually mostly on the neck, because if we can balance this, it helps even this out. Oh, there's one other thing I forgot to tell you guys. And then what we also do is we put what's called low-level laser therapy on the low back. That gets circulation towards the site of fracture. It's an FDA-cleared treatment, which is also, there's research behind it to help with balance, dizziness, and tinnitus. So we take the FDA-cleared laser and we direct it towards the inner ear and that top bone in the neck, and it increases circulation, flushes out inflammation. So lots of research on that. It's really exciting. I can't believe I forgot to tell you about that. But between the little tapping mechanism and the low-level laser, those are some of the things that we do. Okay. Oh, I'm sorry, in the back. And I'll
Can you
come back.
talk about your treatments for tinnitus? What would be involved with tinnitus?
Okay, so specifically, how I treat tinnitus is very similar to the process I just went through, but with tinnitus, we're always going to see a misalignment of that top bone. So I'm going to evaluate all the bones in the body, but there's always a misalignment, usually a rotation and a tilting of that top bone. Then we know that tinnitus can be related to misalignment. If someone comes in and we do the evaluation, we're not seeing that misalignment, I can't help them, but at least then we know.
Can you explain just what tinnitus is actually?
Sure. I can, but let's just go back to the formal definition for you. I didn't put it in. That's why you're asking. That's a great question. I thought it was in there. Okay. So tinnitus is a symptom that can be involved with vertigo. It can be involved with many years disease. But as a standalone issue, what happens is the nerve to the inner ear canal is being disrupted. Can be disrupted from mechanical pressures like the atlas, cervical spine, but it can also be from infection, and it can also be from crystals in the ear as well. But the bottom line is the connection between the ear and the brain is being interfered with. So it's a doctor's job to figure out what that interference is. So when I evaluate a patient with tinnitus, which again, bringing in the inner ear, can be one ear, both. Like I'll see patients who they don't even care about it anymore. They're like, hey, I've lived with this thing forever. It's just going on. I don't care. All the way up to somebody who is just destroying their life, just wrecking. Okay. But I found if mechanically we can get pressure off that atlas, a lot of times that nerve to the inner ear starts to function better, and that tinnitus can die down. Does that make sense? All right, cool. Good. Yeah, and I'll put that in my lecture next time. Thanks.
Yes, what should I look for in a pillow?
Good question. Yeah, she asked about a pillow. Okay. So, pillow type is not the most important thing. It's how you're using the pillow. I do recommend a pillow. It's called the Coop, C-O-O-P, home pillow off Amazon. $40 because it's filled with shredded memory foam, and you can shape it. Okay? But the whole thing with sleep, we actually go through this in some of my other lectures here. Let's say that this is the bed. Okay, so I'm laying on my side. The pillow needs to keep your head in line with your spine if you're on your side. Now, if you flip to your back, it needs to be a little thinner because you don't want your head cranked forward all night. Try to stay off your stomach. It's like the worst position to sleep in. So, yeah, okay? Yeah.
Did you say a coop pillow?
Yeah, COOP, coop home.
You know, I have a rocking chair. And I remember Kennedy had a bad back, so he had a rocking chair. It's not always so comfortable. I have put a pillow behind it, and I always like to have my legs raised. What do you think of it?
I think rocking chairs are great.
But are you supposed to be rocking in them?
Yes. Do you remember on the video where it talked about doing that maneuver with your feet, where you do that?
Yes.
That's actually part of using a rocking chair, where you're pushing down and back on your feet, okay, right, like that to rock, and it actually stimulates circulation. So yes, rocking chairs are great, especially if you sit in them properly. Oh, yes?
I wanted to go back to the vitamin.
The vitamins, okay. No problem. Anybody else? Okay, guys, the gals are here with, oh, yeah.
I know people who have humpback. Is it curable?
So humpback, which again, the technical term is called kyphosis, which is a curve associated with dowager's hump. Yes, it is in some cases. In some cases, it's more manageable, you can reduce it. And in some cases, you can at least limit it from getting worse. The x-ray will tell me a lot, because if there are still discs in the neck, even though past 40 the discs kind of die, it's just kind of a rubbery material, it's still valuable. If there's still some discs in the neck, I know how much I can help. Also, when I teach a patient their stretches and home exercises, if they do those, that's part of it too. But yes, it's anywhere from just managing it from getting worse to actually reversing it.
The reason I'm asking is the doctor is telling her they can operate on it and help to straighten up by 10 degrees, which is quite a bit.
I've never had a patient had to go on and have that surgery to correct the hump. I've seen patients after they've tried the surgery and then they come to me. So my opinion on that is, and I don't know who you're referring to, but wherever they live, find them somebody that does something similar to what I do prior to going in for surgery, because you want to be natural first, okay?
Which is very dangerous.
No, it is, absolutely. You want to, the hump is dangerous, and of course you want to avoid surgery when you can. Good question. Well guys, that was an absolute blast. Thanks so much for having me.